Hello, thanks for listening. I'm Christopher M. Michaud. This is the Canadianist podcast. And in this episode, we're going to talk about a headline published by the National Post on January 24th, 2026, claiming that Canadians are now spending close to $1 billion per year to cover healthcare costs for refugee claimants, and what's actually driving that number. That headline has since been reposted and circulated widely on social media. It has also been used by some members of the Conservative Party to reinforce their position on immigration and government spending, including Rachel Thomas, Member of Parliament for Lethbridge, Alberta. When a headline like that appears in a major national publication like the National Post and then gets amplified by elected officials, it carries weight. It's meant to. But whenever something sounds explosive, it's worth slowing down and asking a disciplined question. What's the full context? Because numbers without context can distort public understanding. Canada operates the Interim federal health program. It provides temporary health coverage to refugee claimants while their cases are being processed. It exists so that individuals who are legally in the system awaiting a decision are not left without essential care. It is not permanent coverage. It is tied directly to immigration status. While a claim is active and eligible, coverage applies. Once a claim is conclusively settled and the individual is no longer eligible under the law, comprehensive federal coverage is supposed to end. So where are rising costs coming from? The backlog. Canada's refugee claims backlog has grown significantly. When cases take months, the system is manageable. When cases take years, the numbers compound. While individuals are waiting in administrative limbo, they remain eligible for temporary coverage. A slow system becomes an expensive system. That's not ideology, that's arithmetic. Now, here's another nuance that doesn't always make it into the headline. Even when someone's claim is refused and federal eligibility ends, emergency care in Canada cannot legally be denied. Hospitals must provide urgent treatment. That is part of our legal and ethical framework. If federal coverage is ended, provinces and hospitals may absorb those emergency costs. That is not the same thing as unlimited comprehensive coverage, but it does create fiscal pressure. And again, the driver is delay. Delay in processing claims, delay in final determinations, and delay in removals when claims are refused. This is where the United Canadian Centrists offer a balanced solution. Compassion and control must operate together. You can't have a humanitarian system without credibility, and you can't have credibility without enforcement. Here's what we would do. First, clarity of eligibility. Once status is conclusively settled and federal eligibility ends, comprehensive federal benefits end. Emergency care remains protected under Canadian law, but full program coverage must follow legal status. No ambiguity. Second, we clear the backlog, increase adjudication capacity, impose firm timelines, modernize case management systems, publish transparent metrics so Canadians can see how long claims are taking and why. Claims should be decided quickly and fairly. Quick decisions protect taxpayers. Fair decisions protect legitimate refugees. Delay protects no one. Third, enforce final decisions. If a claim is refused and no further legal avenues remain, removal must be timely. That means stronger coordination with the Canada Border Services Agency, streamlined deportation procedures, and practical agreements with countries of origin. A final decision must mean something. Canadians are not rejecting compassion. They are rejecting drift. They are rejecting ambiguity. They are rejecting a system that feels uncontrolled. Control restores trust, and trust sustains compassion. If this resonates with you, read the full breakdown at thecanadianist.news. And to learn more about how the United Canadian Centrists plan to bring balance, discipline, and accountability back to federal policy, visit uccparty.ca. I'm Christopher M. Michaud, leader of the United Canadian Centrists. I'm a Canadianist, and I invite you to continue the conversation at thecanadianist.news. And to learn more about the United Canadian Centrists and our vision for Canada's future, visit uccparty.ca.